Assalamu alaikum, everyone. Hope I am audible to all of you. So today I came live for a very important topic that I am now frequently I get messages that in this pandemic situation when there is second wave is going on. So is MRCPCH exam is postponed, or part 1 exam and part 2 exam, the both theory exams are not going to be conducted or not? So that's why I came here live, so that my all of the students from all over the world, they can understand that there is no postpone of theory exams. So all the theory exams like part 1 and part 2 AKP, they are actually running on schedule time. So nothing to worry about. Your exam will be on due time. Like recent exam is in 9th June and then in October. So I would suggest you not to worry about the postponement of a theory examination. Now, regarding the clinical examination, actually in this era of this pandemic, we are facing a lot of bad situations and all over the world, not only for this exam. All the exams are clinical exams are delayed because clinical exams are face-to-face exams. So that's certainly the face-to-face exam is now getting difficult because of the interaction between the patients, parents, and the candidates. So for the clinical exams, any kind of clinical exams, its new system is been now modified, that is the virtual exam. So last in UK, last two exams were virtual exams, and it was successfully run in UK according to the website. So we can hope that if the next pandemic is going on in this 2021 or 2022, then we can get the chance of giving exam in virtual platform. That will be an online invigilator who will monitor you, and in front of the laptop, like live, like I am here. So live exam will be face to face but on virtually. So we can expect that this kind of exam will coming on this pandemic era. So nothing to worry about. And regarding the part 1 and AKP, they are theory exams. So these theory exams are, I don't think they will stop the theory exams. So you can continue your study. Now the most of the question I get from the students that madam, will they stop the theory exam as the clinical candidates are backlogged? So I don't think that the clinical exam is a obstacle for the theory exam. Okay, because the theory students who will pass the theory exam, eventually they will give clinical exam sooner or later. And sometimes there is a bar of 7 years after passing both the theory parts. You have to pass the clinical within 7 years. But in the RCPCH, they said that due to this pandemic situation, these years will not be counted. So your examination, after theory examination, these pandemic years will be deducted. So it will not be counted on the 7 year of bar. So this is my advice, that you should not postpone your study. You should continue your study, and you should not worry about the exam situation. Whatever the situation, we are doctors. We have to progress ourselves. We are most of the important point is that we have to progress in our knowledge. Otherwise, how we will treat our patients, our kids, right? So I don't think that in this pandemic will be an obstacle for the theory exam. But for the clinical exam, yes, definitely there is a point when we cannot come in contact with the patients. So what we should do, we should prepare ourselves for the clinical exam, and we should continue our progress in life. And then whenever the nearest date comes to us, whether it is virtual or if I have center in my country, like there are many countries who have centers. So those students who have centers, they can sit on the exam, and those students who doesn't have center, we can request RCPCH that please let us give virtual exams, as this COVID situation is going bad day by day. So we can expect that RCPCH will soon open a virtual platform for the candidates who doesn't have a center for their own country. So in a gist, that because of this pandemic, because of this corona, you should not postpone your study. This is the main theme. You should continue your study, whether you are in any part of the MRCPCH, like part 1 or AKP or clinical. Now the second question I am getting nowadays, that is, some students says, madam, I want to give part 1 before part 2, I want to give part 2 before part 1, can I give this? Yes, it is clearly written in the website, RCPCH website, that any theory exam you can give alternately. I mean, AKP you can give before part 1, and part 1 TAS and FOP you can give separately. But you have to pass all these 3 theory exam, like TAS, FOP, and AKP. AKP, there is also 2 paper in the same date, paper 1 and paper 2. But in AKP, you can pass combinedly. I mean, paper 1 and paper 2, both the paper passing mark is combined. So even if one paper you do not do well, but the another paper is well, then you can also pass. So this is a very good news for us. But in the part 1, you have to pass separately. Part 1 FOP and TAS, you have to pass separately. So now another question is that I get that what are the training requirement for MRCPCH? Now in the website, RCPCH has clearly mentioned that 2.5 years training will be an added advantage. So if you are a trainee of pediatrics in any level, you can give exam, but there is no mandatory 2.5 years training program actually. But you need a supervisor. That supervisor will be your clinical supervisor, or it can be your hospital supervisor, it can be your medical college teacher who was in pediatrics and who was your mentor. So any mentor, if he is an MRCPCH holder, then it is very good. But even if he is not an MRCPCH holder but consultant at your home country, he can be your guide, or he can be your referee. So you need a referee under whom you did pediatric training. This is a very important part. Another important part is that you I think you should do some training for the better understanding and in clinical attachment, like you are attached with the pediatric patients. Otherwise, if you are only sitting at home, then the clinical exam will be a little bit difficult for you. So I will suggest you that even if you are not doing any work currently, but you should at least get attached with some pediatric hospital or some pediatric clinic. Even if it is weekly, 1 day or 2 day, you can go there and you can do an honorary training, or you can do a attachment training, so that it will enrich your CV also. And also in MRCPCH clinical exam, you have the highest chance to get to give this exam. But there is nothing mandatory about this clinical and training program. Another question I get what is that in this COVID situation, how can we study? We are not able to study. Our family members are getting affected, and our colleagues are getting affected. We are really in a risk of corona. Yes, I totally agree with you all, because as a consultant, I am also facing this situation daily. We are treating corona patient directly, we are getting contact with them. But what my suggestion is that we are born as a doctors, right? So our professional requirement is study. Okay, this is not a selfish act. You don't think that you are studying in this pandemic, it is a selfish act. I don't think so, because if you want to treat the population, if you want to treat the pediatric patients, you must have an adequate knowledge. So this last 1.5 year, this pandemic is spreading all over the world, and so it's a long time. So if you are thinking that I should not study in this pandemic situation, the situation is very horrible, no, I think we should gather your mind, you should gather your worry in a certain place, and then you should think that I am studying for the benefit of my patients, right? This study is not for me, because I will not treat myself. I will treat the population that my country population or another country. I will treat the pediatric population. So I think in this pandemic situation, if you are just sitting at home in a lockdown, you have no job, you don't have to go hospital, I think this is the best opportunity for you to pray for all of us, and also to study. Okay, so don't get disheartened, don't think that pandemic will hamper my study. I don't think so, because your study is your responsibility. Okay, and regarding the courses for part one, I have a batch that is part one and AKP. So my batch is running for last 1.5 year, and almost 250 students are passing out from my batches. So you can also pass without any tuition or without any coaching, but it may take a lot of time for you to gather the material, to gather the syllabus. So that's why, if you are attached with a group, if you are attached with a mentor or any institution that are giving you the suggestion, that are making your effort to study, so it will be a very good. Some student ask me that which course is better for clinical. Actually, there are a lot of courses nowadays going on for clinical, and especially in this pandemic, when all of us are just sitting at home, most of us are sitting at home, and we have to study, and we don't know how to study. So you can attach with any mentor you like, who have been experience of teaching for many days, and you can study at home also, by you can take self preparation also. Okay, so this is the main theme, that whatever is comfortable for you. If you think that you need a teacher, you definitely contact a teacher. If you think that no, I can study alone and I can do myself better, you can study yourself. There are lots of channels where you can get the materials. I have my channels for MRCPCH part 1, part 2, and also clinical. You can enroll in these channels, that those are free for all of you, and there are lots of materials we share with each other, so you can be benefited. So I hope this live was helpful for you, and it solved many of questions that you asked me in my personal messenger and personal WhatsApp. So I think you should continue your study, and you should not get panicked that exams will be stopped. No, the exams will not be stopped, because the day by day, the demand of the doctors, demand of the good pediatricians are increasing. So there is nothing to worry about the stoppage of any exam, whether it is theory or it is clinical. Our CPCH are working hard for this virtual exam platform. So soon all the clinical candidates will get the chance to give the exam. So better if you practice yourself, practice in a group, or get enrolled in a course, like any course you like, part 1 AKP or clinical. But for clinical, you have to pass all the theory exam, the 3 theory exam. So I hope this live was helpful for you. Soon I am going to conduct another meeting for AKP, that will be also in live. If you have any queries regarding my courses, or regarding any question regarding RCPCH or MRCPCH exam, RCPCH actually have a very good website. You can go through this website, and you can search anything you like, and you can ask them question. They have a mail address in the bottom of the website. You can directly mail them. Okay, so this is for today. See you inshallah in our next live. Till then, you can watch my YouTube channel for the free videos I have regarding MRCPCH part 1, part 2, and also clinical. Okay, thank you everyone for watching this video. See you soon. Bye bye.